How are you, everybody? This is Limo TV. Thank you for tuning in. Today, we're going to talk about coronavirus. I have my guest, Ryan. He's 10 years old. Thank you for coming in.
You're welcome.
Okay, you should raise your voice, please. But it's okay, it's okay. It's fine, it's fine. So, we are running out of supplies. I work in the hospital. Honestly, we've been losing, or I don't know if somebody took it. We ran out of 10 millions, thousands of masks. They are disappearing. So, just to tell you, everybody's using one, two, like every 10 minutes. We are running out of ventilators. Not only where I work, because we don't have any case yet, but around the world we are running out supplies, gowns, gloves, masks, and most importantly, we are running out ventilators. So I'm going to show you what's going on. And on top of that, we are not running out of doctors. So they are calling out, even if you're old but you still can function, come in. So I want you to see what's going on right now in the world.
Till further notice. Well, as the COVID-19 pandemic spreads in Canada, a petition is circulating to mount a warlike effort to help healthcare workers. Doctors are saying the front lines are running short on supplies. Joining me now is Dr. Michelle Cohen in Brighton, Ontario. She is one of the doctors who signed that petition. Thank you so much for joining us.
Thank you for having me.
All right, so let's start with, why did you feel it was necessary to sign the petition?
So we're hearing from across the country, from our colleagues across the country, and we're experiencing it ourselves in our own local healthcare systems, that we are running short on supplies. And given that we are just at the beginning of this crisis, we're quite fearful of what is going to happen if we run out of supplies.
Absolutely. And when you talk about supplies, break down for our viewers, what exactly are you talking about? Because I know it's important for healthcare workers to have supplies for their own safety, but specifically, what do they need?
So specifically, we're talking about personal protective equipment like surgical masks, N95 masks, which are in very short supply, goggles and face shields, because we know that this virus can be spread by aerosol, so that can contaminate people's faces and can get in eyes, gowns to protect our clothing, and other equipment like that. So basically things to cover our faces, our bodies, and our clothes.
Very important stuff. And Dr. Cohen, have you been experiencing the same sort of pressure at your office that you work at right now?
So we're definitely running short on supplies right now. We've made sure that we're keeping our stuff under lock and key. Our N95s we're keeping them under lock and key so that we don't have patients walking out with them. We're trying to be very careful and resourceful in how we're using them. We're sparing in how we're using our masks. And we're hearing, too, from our local hospitals that this is an increasing problem where people are stealing supplies and running off with them. And that's a really terrible thing, both for the healthcare workers, but also given that the healthcare workers are looking after everybody else. If we get infected, we are a huge source of infection for other people, for our communities, and for our frailest patients. So it's really quite a problem.
Yeah.
Just to tell you that in Italy, they are running out of ventilators. They have to decide who to die. If you have 5 people in your unit and you have only 2 ventilators to help them to breathe, what are you going to do? I don't know what is the criteria, but it's somebody who's going to pass and somebody can leave. Thank you. Ryan, let's go back to you. Thank you for coming in again.
You're welcome.
How do you feel to be confined in the house because of this coronavirus?
Well, for me, since I'm a kid, I feel limited for the stuff I usually go. I had a camp I was supposed to go today, and it would end on Monday. But now, since this coronavirus has gone too far, I couldn't go. My school is going to start, I don't know when, and like other kids are missing out on activities that they should have done during spring break. This coronavirus is limiting all our access to public uses, and I advise all adults, any ages, and all kids to stay at home unless it's really necessary. Grocery shopping, and back to you.
So when you think about this virus,
Yes.
how do you feel? Do you think kids gonna be sick too, or they are protected, or they are not? So they are not included in those people who are dying.
Well, for sure, some kids are going to be affected by the virus, and they also need to be concerned about how to stay hygienic and keep washing their hands. If you can find masks, buy wipes, masks, and gloves. And if you can, keep your kids inside at all times.
Thank you for your advice. I think you learned a lot, and we thank you.
You're welcome.
So just to tell you that we are running out of supply, but as he said, stay home, try to eat not as much as you can, but as less you can to keep some food in the fridge. Manage your budget. We're not going outside anyway, but try to do your best. Protect yourself. This is a huge disease. Let's listen in French what they are saying. Hold on, give me a second.
D'heure en heure, ce sont des milliers de Québécois qui apprennent des mauvaises nouvelles. Ils sont mis à pied. Aujourd'hui, le Cirque du Soleil a annoncé qu'il était forcé de mettre à pied 95 % de sa force de travail, plus de 4 600 travailleurs. Aéroport de Montréal, il y a environ une heure, annonçait également 200 mises à pied temporaires. Et donc aujourd'hui, c'était au tour de Québec d'annoncer son plan de soutien aux entreprises qui éprouvent des difficultés, un peu d'oxygène pour les entreprises qui doivent traverser la tempête du coronavirus. Ce sont donc 2,5 milliards de dollars que le gouvernement Legault débloque en aide directe. Le premier ministre note également que tous les Québécois devraient acheter local, et ce, même sur Internet. Ce programme d'aide financière aux entreprises sera administré par Investissement Québec via des prêts et des garanties de prêts. François Legault l'a martelé, il est important plus que jamais d'acheter des produits vendus au Québec par des Québécois, fabriqués par des entreprises de chez nous, qui traversent à l'heure actuelle des moments extrêmement difficiles. Cette nouvelle aide financière du gouvernement québécois sera accordée au cours des prochains mois et un minimum de 50 000 $ donc sera accessible pour nos entreprises. Partout à travers le monde, il y a aussi ces entreprises et des hommes d'affaires qui veulent mettre la main à la pâte. Aux États-Unis, par exemple, de grands constructeurs automobiles, je pense à GM, à Ford, proposent de fabriquer du matériel médical sur leur chaîne de montage. On veut convertir en quelque sorte des usines. Il y a plusieurs discussions avec la Maison-Blanche à cet effet. Interpellé sur Twitter, vous le constatez, le grand patron de Tesla, Elon Musk, a également proposé que son usine soit utilisée pour fabriquer des ventilateurs et des respirateurs artificiels